My name is Mark Kilgore. I am the program coordinator for Project Vox, CARE Southeastern Michigan Recovery United Community Center, and I've been employed at CARE for 10 years. For many years now, we have been in the middle of an opioid epidemic nationally and here in Michigan and Macomb County. So according to the CDC's National Center for Health Statistics, there were an estimated 100,306 overdose deaths in the United States from April of 2020 to April of 2021. So there was nearly 3,000 in Michigan alone and over 300 in Macomb County in that same time period. Before the pandemic hit, we were actually starting to decrease in the numbers of overdose deaths. And I think a lot of that attributed to the fact that Narcan, which stops the onset of an opiate overdose, was made more readily available to the public, where anybody could get Narcan at no cost. Organizations are doing trainings and distributing it. So we did start to see a decrease, and then when we had the lockdown for COVID, we had to go into isolation, and the overdoses started to go on the rise. And that had to do with the isolation, people being isolated, not being able to get out to support groups, different things like that. Access treatment, actually some of the treatment centers were shut down for a while because they didn't want to bring COVID in, to the residents that were in residential treatment at the time. What Narcan is, if somebody's experienced an opiate overdose, it only works on opiates, so that could be prescription painkillers, heroin, fentanyl, illicit opiates. It's a nasal spray, which I brought a sample of. It's very simple to use. If somebody's experienced an overdose, you insert the nasal spray in their nostril, you push the center plunger all the way. It is one dose. And what that does is it knocks the opioids off the receptors throughout the brain and body, and it gets the person breathing again and their heart beating once again. Now, it does wear off in 30 to 90 minutes, so somebody could go back into an overdose if they don't seek medical attention. It's very simple to use. It's very available to the community. We have drive-through at our office. People can pull right up. They don't have to get out of their car. We have a designated parking spot. They can pull up, call the number on the sign, and we will come out and do a Narcan training while you sit in your car. Or you can come up to the door and we'll let you in and do a Narcan training, and you will leave with Narcan at no cost. We don't ask any questions about why you want it, who's for. That doesn't matter to me. I believe everybody should carry it because people are overdosing out in the community. So you don't have to have a family member or loved one that's abusing opiates. To me, I view it as knowing CPR. We should carry it as well. I could go on for days on examples of people that have overdosed in public, and people have called me and said, hey, I used the Narcan, I was able to save their life. I got a call yesterday on it. Somebody called me and said, yeah, I used 2 doses of Narcan on my neighbor's child and was able to save their life. So I believe everybody should carry it. A lot of pharmacies now have it in stock too. Some insurance companies will carry it or cover the cost, but why pay for it if you can come right to us? And there's other agencies too throughout Macomb County that are doing it as well. If you have a group of people that you want trained in Narcan, as long as you're within the borders of Macomb County, I will come right to you and do a training in person. Or we can set up a virtual training and then a pickup time. We actually did it through the lockdown too. We created a protocol for no contact. So I would do virtual trainings, then people could come the following day and they could pick up their Narcan from outside of our building. One way to tell if somebody is overdosing on opiates is they may be non-responsive. You can't wake them up by shaking them, doing a sternum rub. The one thing really important to remember is the pupils of their eyes will be a pinpoint. That's a dead giveaway that it's an opiate. Their breathing could be shallow or stopped. Their heartbeat could be slow or stopped. You could hear a snoring or gurgling sound. Could be a foaming at the mouth or vomiting. The lips and fingertips could turn blue or gray in color. The skin is pale and clammy. So first thing you want to do, if they're non-responsive, call 911. Get them on the way. then you want to administer the Narcan to them. So you, if possible, you want to lay them on their back, insert the nasal spray in their nostril, push the plunger all the way up completely, and after you do that, you want to lay them on their side because they're going to go into immediate withdrawals and they could vomit, and you don't want them to suffocate. If their heart is not beating, you want to administer the Narcan and perform chest compressions because it can't get through the bloodstream if the blood is not flowing. And I always encourage everybody should know CPR. Everybody should take a CPR class. That way you know how to do chest compressions properly. We do it at our Recovery United Community Center anytime during business hours. People can come in, get Narcan trained and walk out with Narcan. Or there's a website that you can visit through the state of Michigan. It's called Next Distro. It's NEXTDISTRO.org. You can go on their website and they will mail it directly to your home at no cost. And that is through Michigan Department of Health and Human Services. Right before the COVID lockdown, back in December of 2019, we purchased a new facility. So we have 2 locations now, but this one is called the Recovery United Community Center. All of our services and programs there are based around recovery from substance use disorders. Everybody that is employed in that building is in long-term recovery, and we offer a lot of support groups. We have a men's support group, a women's, a co-ed, LGBTQ. We have art programs that we collaborate with Detroit Institute of Arts, and we create artwork. We have another program called Create with a Coach, which is one of our peer coaches once a month, does like an arts and crafts program with participants, that want to be involved. We have something we call mindful movement, which is yoga, and we do meditation as well. We have Naranon, which is a family support group that have a family member that is struggling with addiction or in recovery from addiction. We have something called Maple Grove Family Program, which works also with friends and family of people that are struggling with a substance use disorder. Once a month, we collaborate with a place called Access Point. They come in and do HIV and Hep C testing. You get your results within 20 minutes, and then will link you to programs and services for treatment for those 2 illnesses. We also have a program called Seeking Safety, which is people that have experienced trauma in their life and may have turned to substances to deal with that trauma. So this is to help them work through the trauma. We have a men's only group and a women's only group. We also have Medication Assisted Recovery Anonymous, which is for people on medication to help them in their recovery. Recovery Dharma, which is a Buddhist type approach to recovery. It's more mindfulness, body, mind, spirit healing. We have Women in Recovery, Men in Recovery. All of these programs that I just shared with you are at no cost. All of our programs are provided at no cost. Anybody that is in recovery, seeking recovery, can come to our center and talk to a peer recovery coach. They could be assigned a peer coach at no cost again, and that's somebody that's going to help them along their journey of recovery, because recovery is not a destination, it's a journey. So we just help people by teaching them positive ways in coping with life when stressors happen, and what obstacles are they going to face and how do we work through those obstacles. If you would like more information on our Recovery United Community Center, we do have a Facebook page, Recovery United. You can follow us and like us, and that way you will see any new programs and services we offer, the new monthly calendars we put out, because we do change from month to month. We may add things because we are person-centered. So we have programs based on what the people we serve want. So it's not about what I want, it's about what our participants want. And you can also go to Care of Southeastern Michigan, and that will give you a link to our Recovery United Community Center as well. If you are struggling with a substance use disorder, a family member or loved one, as long as there's breath in your lungs, there is hope for recovery. Recovery works. I myself am a person in long-term recovery, which means for me I haven't used drugs or alcohol since July of 1998. And because of that, I have my life back. Recovery does work. So please reach out if you need help or a family member needs help.